We're here today in the Department of Health to talk about the Women's Health Taskforce about the menopause, which is our topic of interest and passion. The key thing about the menopause is that it will affect 100% of women, which there are not many health issues that affect all women. And symptoms can be very varied. They can be psychological as well as physical, and I think that's something that's not that well known. And also another important thing is that a lot of our symptoms take place during perimenopause, which is possibly 10 years before actual menopause.
Some of the symptoms that you can see in perimenopause would range from anxiety, loss of confidence, hot flushes, night sweats, weight gain, difficulty concentrating. Maybe sometimes people can feel that they don't want to be as social as they've been before, and that's something that's very important to take care of when you're in menopause. It's important to educate yourself in terms of the various ways that you can help yourself, and certainly, for a good place to start is talk to your GP, look at your blood tests, have bloods done, and just make sure there isn't any other underlying issues that need to be taken care of before you make a plan of attack, really.
Because it is a natural process, but sometimes it can be very troublesome and difficult if other aspects of life aren't working, and particularly if you're feeling very stressed or if you're nutritionally not quite right, which a lot of us aren't. By the time we get to our 40s, we're kind of stressed out and deficient because we've been working so hard in our 30s and 40s, building careers and families. So the thing to do is to find out as much as you can in advance. So in your early 40s, try to learn about what is the menopause. And it isn't something for old dears, which I thought it was. I expected to be grey-haired in 65 or something, whereas it's actually for women who don't expect this to be the menopause when they have symptoms in their middle to late 40s. So it's earlier than you'd think.